We have Tim Hunt, who has been the team leader for this initiative. Tim Hunt is a research scientist and associate director of the Columbia University School of Social Work, the Social Intervention Group. We have Sholpan Primbetova, who is the deputy director of the Global Health Research Center of Central Asia. And we have Don Gruss, who is the director, training and technical assistant at the Columbia University School of Social Work, Social Intervention Group. So welcome, Tim and Sholpan and Don. And also we have our Deputy Regional Director with us, Octavian. Aaron and I, we are going to facilitate the session. Can you put the slide on the goal, what we want to achieve? As some of you remember or are familiar with this process, the whole story started in Bucharest in 2018 with this regional conference on social service workforce. And then one of the results of this conference was a call to action on strengthening the social service workforce in Europe and Central Asia. And one of the core competencies that was identified there in the call to action was these soft skills that we call interpersonal communication and community engagement. After that, in 2019, we commissioned Oxford Policy Management to do a mapping of good practices in social work education to identify how these curriculum in different countries integrate social science and in particular behavioral science that to engage with communities and clients. And then, so we started probably 5 years back with Columbia University, this partnership. Columbia University is a very global authority in that area. They interpreted these findings from this mapping, and also they did further assessment and research, and then they developed, together with country offices, colleagues from child protection, developed this curriculum. As you know, this curriculum has been implemented in 8 countries based on the evaluations, and we are talking about pre-post evaluations, and based on the feedback obtained from these trainings. So we have a revised version of the curriculum that is now available in Agora. And then the main purpose of this call is this webinar is to reflect on the theoretical approaches to this curriculum, integrating or the integration of applied social science, behavioral science into the social service workforce training with focus on strengthening interpersonal communication and community engagement. And present, because now the curriculum is a public good, so the idea is to present it and then to discuss the scale-up opportunities. With that, so this is the agenda. I would like to give the floor. I mean, it's a structure in the, we have an introduction, the presentation of the curriculum, the opportunities for scale up and the wrap up. So with this, I will give the floor to Octavian for the opening remarks. Over to you, Octavian.
Thank you very much, Mario. Do you hear me well?
Perfect.
Yes, perfect. Colleagues, pleasure to join this webinar aiming at disseminating the training package for social service workforce on such an important topic, which is building competencies for interpersonal communication and community engagement. And at the onset, I really would like to first congratulate, but also to celebrate this excellent partnership with the Columbia University, but also with the Global Health Research Center for Central Asia. and of course the UNICEF team that have been working together to put together this training package. I don't think this is an audience where we should emphasize how important the social workforce is for anything we do on social protection or child protection, including prevention and response to violence, poverty, discrimination, social exclusion. It's key for the implementation of the Convention of Rights of the Child, for the CEDAW, for the, of course, the CRPD, but also the European Agenda on Human Rights and overall implementation of Sustainable Development Goals. Therefore, for UNICEF, strengthening the social services and social service workforce is a key pillar of our regional agenda, and it contributes to the achievement of a number of regional flagships results. So it cuts across all flagship areas. And of course, the social service workforce is that junction between health, education, protection, and other systems. So indeed, it's this workshop and this training package and the webinar for dissemination is central and so relevant for our work. Now we know that when we refer to the capacities of social workers, but also some other social sector workers, we quite often refer to the technical capacities, the hard skills. And I'm very pleased that this package is actually focusing more on the soft skills or the foundational skills, which are so essential for providing the necessary support to most vulnerable children, most vulnerable families, and those soft skills focusing on interpersonal communication, community engagement are, as we all know, critical for creating open, trusting, productive relationships with children and caregivers. And therefore, quite often it sounds simple, but in fact, the development of these skills is not easy at all, as we know. And therefore, this training package and the approach should include addressing pre-existing attitudes and beliefs, pre-existing cultural biases or factors, ensuring that the workforce has the buy-in and the necessary investment in this, and then the building a knowledge base and honing very practical skills for using in diverse settings. And that in turn entails, of course, learning to reflect on personal values and biases, ethical dilemmas, and creating safe spaces through verbal and nonverbal communication. So I'm sure that all of that would be extensively covered in this package, and I would like to reiterate the sincere appreciation of the effort of all partners that took us to this point when we are disseminating this package. I personally look very much forward to hear and to learn from this experience, and of course UNICEF will continue prioritizing in different areas of our work this important skills building effort. So thank you so much again. Congratulations to all. Looking forward to a good start and then most importantly a good continuation of this effort. Thank you, and back to you, Mario.
Thank you very much, Octavian, for this setting the stage for the next parts. So over to Aaron.
Thanks so much. Hi, colleagues. Hi, everyone. I want to build on this introduction. There's this slide that you're seeing now is the slide that was developed based on the 2018 Social Service Workforce Conference held in Bucharest, Romania, which was attended by all governments across our entire region, in which we created a framework that looked at, what is the social service workforce? Who are the allied workforce professionals and other allied workforce and sectors? And we started to think about the different levels of training and specialization in these different social service workforce, which includes, of course, social workers, as you see the occupation on the left, but goes all the way through to social pedagogues, speech therapists, those who administer social insurance, police, those in the health and education sector. And who are we talking about in these sectors? We're talking, within UNICEF, oftentimes in the health, if we think about the allied workforce, all the work we do around home visiting nurses, right? All the work we do to promote home visiting nurses that are going into people's homes. So we really came up with a framework that is quite complex when we put it up on the screen. But when we look at the pink bar underneath, this is the pink bar. This is the fundamental skill sets that were identified that every social worker, every allied workforce professional must have. Let me paint a very simple picture for you that you'll all understand, but just to kind of boil it down in very simple terms. The vulnerabilities that drive child protection concerns stem from lack of access to services, alcohol and substance abuse in the family, divorce and interpersonal conflict, and gender-based violence in the family. These things are oftentimes hidden from view. Someone who's entering the home, someone who's attempting to enter the home, to build confidence and trust with a client, with somebody who may need a lot of support, that moment of trust that family will share with you, right? Really what's happening in their lives without fear, without judgment, is everything for being successful in mitigating those family circumstances, in referring to the right services and providing the right support. If you can't build that confidence and trust, if the system and the humans in the system can't do that well, then we fail from the beginning, no matter how many professionals we have out there. And there are other dimensions to this. The diversity of the workforce, does it represent the communities that they're serving? Of course, is a big part of it. Is there supervision and mentoring and support systems? Of course, there's a whole ecosystem around this that needs to be there. This piece was really looking at what are the most modern and sophisticated and human rights-based approaches globally in terms of that base training. And how can we bring that as UNICEF with a partnership with Colombia into the spaces of our country programs, into the partnerships we have with academia, with governments, to encourage them to revisit their own curricula, to revisit the way they do this, to look at the different sectors that might benefit from this, and to see in creative ways how to motivate for looking at those important core competencies of the social service workforce. That is what the spirit of this has been. And I am incredibly delighted that we've reached this point when, we went from conceptualizing this to really, as a region, together, at least on one piece of this and on the pink bar below, really trying to together go through a journey. And we've been accompanied by Columbia University. There have been over 8 countries in our region, country offices in our region, who have done this work. And we're going to hear about that. And we're going to hear about this global good that's been produced by Columbia and UNICEF, which is now ready to be used by others. And I'm delighted to have been able to say a few words about it. I'm delighted to have been a part of it. And it's been an excellent partnership, not only with Mario and the SBC team, and Vincent, thank you, and Mario, thank you for all of that, but also a real partnership across teams in the regional office, including the gender colleagues, disability colleagues, and others who I think benefit tremendously from this work. So thank you. Thanks for giving me the space to speak to this slide. Back to you.
Thank you. Thank you very much, Aaron. So hand it over to the Colombia team.
Thank you so much, Aaron, for those thoughtful words, and Mario for your leadership throughout this project. And thank you to all of you, which have been, many of you been on the journey with us in developing these collaborative materials. We're so excited to see them now available to the public, and are excited to see where they may go. And certainly the goal is to help improve the lives of families and children being served by UNICEF. Never before in our history have we needed a social service workforce skilled and ready to provide service than now, given the number of stressors that we're seeing around the world. Columbia University, the oldest school of social work is ready to partner and has been partnering to build expertise of those who are seeking the profession of social work, but also working alongside those other allied professions, given that we certainly have learned from many different professions and theories to be a multimodal approach. We have we've always been charged in bringing people together to discuss and defining problems together and then coming up with solutions together as communities. So we welcome the use of our 8 centers around the world, and we're hoping this particular package and initiative can continue to grow and we can work and learn with you together. The initiative, the division in the School of Social Work, the Social Intervention Group, around 30 years, is partnering in research, developing evidence-based practices, along with training methods in order to build the social service workforce. We mentor students, PhD students, master students, and those also who come to us from global regions are here to go back to their home countries to apply the core skills that they are learning. We are continuing to already partner with you. And one of our main partners in the Global Health Research Center in Central Asia, I'm going to turn this over to Sholpan Primbetova, the Deputy Regional Director there.
Good afternoon, dear colleagues. It's a pleasure to introduce one of the Columbia Global Centers, which was established by the president of Columbia University back in 2004. We have been working in the field for more than 20 years. And here's the management. All management team has the US degree in either social work or public health. So Asil, me, Gauhar, and Mirer. We are all are the investigators in the field here. We do research, we have behavioral research, and here's how our partners in these projects. We have countries in Central Asia, Kazakhstan, Uzbekistan, Turkmenistan, Georgia, Caucasus country, and Europe. So Albania, Greece, Montenegro, and Serbia. Thank you, Tim.
Thank you, and thank you to all our colleagues who have contributed to this this occasion where we have this revised and designed package ready for public consumption. Again, our goal all along, as Octavian and Aaron have said, and Mario, we are here to build and strengthen skills based on interpersonal communication and community engagement, specifically those competencies needed by the social service workforce so that they can serve and support the behavior and social changes from both vulnerable children, families, groups, and communities working together. We did focus on Europe and Central Asia as part of this initiative and are eager to expand the access to this work around the world where UNICEF touches and where Columbia also goes. Again, when the trainers come to this particular curricula and you use these components, we hope the participants, again, follow these set of learning goals, that they not only are hearing around theory, evidence-based practice, but they're actually applying it and practicing it in real time. We know that that is the way that we learn. We learn collaboratively in modes in which we watch and listen and hear others learning, but then we actually need to practice in order to see those skills develop and utilize and sustained. It's why we not only just developed the curriculum with you, but we also did it within what we call a community of practice, where we brought together in-country offices, universities, academia, along with service providers in the field, come together as a community, learning and sharing the goal of improving competencies and ready to share those competencies with those social service workforce within their initiative. So it is the curricula, it is the train the trainer mode, in which is thinking always about sustainability. And then it again is this collective learning, which you can think through your particular strategy when Aaron talks to you later, how you'd like to scale this up in your particular country or region. It is always meant to think not only the kind of international standards of competencies, but also how you adapt it to the local community, the culture, the needs and examples of that particular community. And how do you do that? You do that through a skilled training cohort. And you do this through the community of practice and partnerships. That's the way the model works for sustainability all along. So the skills are not only applied at the individual level, those children, those families, those parents, those adults coming in for services, but also within a community setting, defining together what are our primary problems, what are the priorities, and how do we use these particular skills in a multi-level approach to make change. That might be through a large societal change. It may be through local, very individual change. It might be working through schools, other types of government organizations, but it is multi-leveled in its approach. And then all along, we're thinking about these four-step approach of engagement, assessment, intervention, and then evaluating. Is what we're doing working, right? We do that not only in our service provision, but we do that in our training as well to see if we're actually working. So this is an example of a community of practice. Again, it is meant to be both online and face-to-face. This community of practice with a shared idea around learning particular competencies, the practice together, and then that we care about a particular community, population served, and we're trying to make change in that particular community. We know that certainly we learned a lot with COVID about the access to online learning. We've learned a lot about its effectiveness, but we also know how important it is to have face-to-face, building relationships with individuals, with communities. So it is a hybrid design that you can apply in your particular context, what works for you. And of course, resources are an issue when it comes to training in general. So the training package, as you've seen in the email, certainly is, we're going to share with you the link if you don't have it already, available on the Agora platform, the learning channel there. So we'll talk you through it, and Dawn in just a minute will actually give us a dip into it. The goal was in this particular package divided into two parts, a more foundational part, part one, and then in between the trainings was always the community of practice, looking at answering questions together, applying the skills, thinking about how we may tailor it to our particular context, and of course evaluating all along. The part two a bit more advanced in its approach, and again, there's always additional topic areas that the community of practice comes up with. This particular model of competencies comes from the field of social work. Again, the Council on Social Work Education, which many of our universities, of course, must comply with. These particular standards have been identified as needed to provide those social services at the multi-levels that are needed that I've just referred to. One area that we don't talk a lot about is the area of research. Of course, research is about evaluation at the same time. And I always think even individual clinicians or practitioners, they're doing their own research. Every time they see a client, they're also examining, is what we're doing effective or not? Or you may be working on a larger level in your country offices, evaluating, is the work of UNICEF reaching the targets that we're trying to reach? Again, the two-part, as Aaron talked a bit about, and you heard from Octavian, it does build on the really basic professional ethics on the individual level, the reflection that service providers must do to be attuned to their work. It is the practicing of communication skills. A lot of it built on the motivational interviewing, those basic kind of listening, verbal and nonverbal skills, but very much digs into evidence-based practices, including case management and those approaches that have a staged or phased approach, dealing with trauma and other specific issues, certainly always through the lens of gender equity, through equity, diversity, and inclusion, making sure we're addressing special needs such as addictions, other chronic illnesses such as HIV, and other issues around the world, and those who populations very specifically that have been stigmatized in general. Finally, we did touch on a bit of the technology that we've learned a lot about in the last few years, how your practices may be going online a bit more, and then ways that supervision itself can sustain and build the competencies of your social service workforce. I'll turn this over to Don, who will take us through the package specifically and give us a real dip into the Agora platform.
Great. Thank you so much, Tim. And as you explore these resources on your own, you'll come to really see how the training package is designed to be adaptable and effectively serve, as Tim has mentioned earlier as well, both those unique needs of in-person and online learning environments. And I'm just going to say, just for here, because you can read the slide, is just note when you go to navigate, you'll find it right here with the link. So, all right, let me. Tim, that's okay. I think we can do the, we don't need to do the slides. What I'll do then is I'll just share my screen. All right. So once you log into Agora, you're going to go to the SBC Learning Channel, click on your regional learning materials, and from there you'll go to the ECARO section where you'll see the manuals for all 10 days, both parts 1 and 2, and their respective slide decks. Images that you see here are just for your reference, but as I mentioned before, sorry, there we go. There you go. You'll see these right here at the bottom. And then what we're going to do, though, is we are going to look at day 4 in part 2, which is working with communities. And I took an excerpt here because once in the manual, trainers are going to see a table of contents, the overview where learning objectives and competencies are identified, a daily agenda, introductions, refreshers, which really serve as an activation of prior learning. And then you'll move into the session content itself. So let's just see how this all comes together, where theory meets practice, by looking at part 2, day 4, session 1, working with communities. And this is where you are right now. The excerpt I chose here takes the core competencies of engaging, assessing, intervening, and evaluating with individuals, families, groups, organizations, and communities by applying them in a community practice exercise. The objectives of this exercise are to understand the dynamics affecting community practice, to learn methods of community assessment, to apply those methods of community assessment to practice, to understand the methods of community engagement, mobilization, planning, and intervention, and to learn about the methods of community practice and evaluation to ensure that they are reached. And once that foundational knowledge is laid, the trainer then leads the participants in a breakout activity that mirrors the actual life and work scenarios often encountered in the field. Here, the trainer asks participants to consider a case study related to a 14-year-old male adolescent who stopped attending school to work due to the death of his parents during COVID-19. You'll learn through this role play that his child is not alone in his village. There are others in the community who are going through similar struggles. The task for the participants is to effectively gather information, taking into account the diverse perspectives among the varied community stakeholders, so that a solid plan of understanding for strengths and needs of the community can work to inform a plan of action. And while there is overlap in the manual to the slide decks simply don't mimic the manual. They take content from the manual and expand upon it. In the example I gave earlier about the 14-year-old adolescent who you find here is named Zoran, participants are guided towards collaborative group work through a set of discussion questions so that learning opportunities serve to build a community of practice. Slides also have additional context on the benefits of certain approaches taken. Here you'll see how a traditional needs-based approach leads to deficit-based plans and how asset mapping leads to capacity building upon those existing structures. And this really all culminates, this activity here, in a tangible and actionable product being developed, a community asset map. Further resources are made available throughout the manual, slide decks, and in the references section. And what I mean by that is if there are alternative pathways to kind of achieve the same outcome, there are, different avenues that are being provided. And then what you see here is something that was developed earlier on in the process by, I believe, Sholpan and Mashura during one of the projects that engage them in some community asset mapping. So that is just a quick walkthrough of when you think about doing community assessment, how both the manuals and the slide decks interact with each other, how they support each other. And I will now hand it over to Sholpan. Stop sharing.
Thank you, Dawn. Thank you. And we did a pre and post evaluation component for all our trainings. And this is the examples who were the attendees. If they have the slide, next. Yep, next, yeah. So you see that we, out of 8 countries who began the evaluation, we have 7 who completed. We have total 179 TOT attendees. And you can see the distribution in the chart. And the next, please. So it's on the organizations engage. So engaging a variety of stakeholders and different organizations were the most assured us more sustainment of gains made is likely. So we had people from the ministries, from the government who were really interested to take over there because we thought about the sustainability of the project. So the countries invited the government representative as well. The next, and from the educational background, as you may see, the training package was effective if not only beginning the trainer or participant, but also had advanced education, not only master's, but a PhD in social services, social sciences, and having a range of expertise, as you can see now on the graphs, made the training very fruitful and richer. And the next, please. So there you may see the competencies are applied to a variety of population seeking services. So it's families, children, women, and young adults are the majority of the beneficiaries who been served by our trainees. And the next, so it was we had very strong scores against the different variables, such as that information was very clear, all structure, all procedures of the training preparation were clear, people enjoy the training environment, orientation process was very helpful, and topics enhance skill sets, and the balance of theoretical part and the practical part. And one of the main points is that we integrated all feedback in the final product. It's been a long process, so it took several months, but we wanted to be sure that every feedback, every voice is heard, both from the participants and from the trainees. And this is the slides. Yeah, while the most feedback was positive, so we incorporated the constructive feedback in the curriculum practice to prioritize the examples illustrating gender equality, child protection, and community engagement. As Rania is here, thank you very much for all your great input on community engagement in the potentially abusive context and emerging public health issues such as addiction, poverty, chronic illnesses, for example, as HIV, and challenges inherent for families experiencing migration or displacements. And for trainers, it was also a major responsibility to manage time within the given and experiential design for learning. So the countries, then you're going to use it, it's a lot of materials for you, for TOT, and please enjoy and choose whatever is the most priority for each country. This is the testimonials we have. These videos are available, and we have Azamat as one of the participants here, who were the participants, but now is a UNICEF staff member. Please ask for access if you're interested to see these testimonials. Very much. Over to Tim.
Thank you so much, Sholpan. And just so in summary, this particular package is responsive to emerging needs. It's adaptable. It can be applied to a varying of readiness of a particular country. And of course, as we see in that we have emerging crises that need to be responded to, this particular package and its core competencies can be applied to those contexts as well. What is key, as I've said, is the responsiveness to tailoring the materials to the local level, making sure that the lenses and priorities of cultural context are used, gender equity, and really engaging the local stakeholders who are the experts in their particular populations. And I must say also engaging people who are served in also informing the process as well, those people with lived experience, as you build capacity of those who are doing the social services in your particular context. Again, the ease of access, you have the link to download the PDF formats. You can also reach out to UNICEF for editable slides for tailoring those. You can deliver this in the 10-day overall package, or you can do it by day or by module, depending on the needs of your particular training needs. And finally, if a technical assistance support is needed to actually implement the materials, we certainly are available, as we've said, at Columbia University, to help you through the process, to join you in that process as well. Additional advanced training is also available in things like trauma-informed care, working with gender-based violence and other issues such as families living under conflict. Certainly supervision, as I mentioned before, can advance the competencies and sustainability of the particular competencies in your area. And research methods, of course, is an area of expertise of our team. So I will turn it over to Erin, who's going to take us to thinking about how to scale up these materials in particular contexts. And thank you to our colleagues for joining today to share your experience.
Thanks, Tim. And thank you, all of you, Tim, Sholpan, all of you for guiding us through those materials, and Dawn for the very practical zooming into a module so people can get a sense of what this looks like. You know, we had 8 countries and country offices, child protection and SBC colleagues rolling this out. You're going to hear from 2 of them, Greece country office and the country office in Kazakhstan, although there are others to hear from as well. We chose these 2. They're ready to share their own experiences, and I'll give them the floor in a minute. But I think it's also worth reflecting with this wider group, you know, how we built this, because we built it in a fairly unique way. There was a demand from some countries coming out of the 2018 Bucharest Social Service Workforce Conference to be involved. We had those country offices express great interest in partnering up with regional office and Columbia University to develop these modules and to pool resources together so that these modules could be developed and run in all of the 8 settings. So it was very much a shared and collective experience between 8 country offices, which, to be honest with you, if to be honest with ourselves, you know, resulted in 2 things. One thing is efficiencies and scale. We were able to do a lot more with less resources because, you know, if each country office puts in, I think it was 20 or 30,000, some put in a little more, some put in a little less, regional office put in a little bit, we were able to do a lot more with less and produce this global good now, which we'll talk about the different ways that could be used. The challenges, of course, is that, you know, it's difficult to implement in 8 places at once. You know, it's uneven distribution of progress because, you know, one country is different from another in terms of how it organizes itself. But that was the way in which this was developed. We now have a public good, which you can run with yourself. There is nothing stopping you from using these materials in any way you see fit. And to promote this work and approach, you know, this is a shared public good, and we would like to see it used. But there are opportunities for you to engage in a similar exercise. We could look at a couple of countries who'd be very interested in doing this together in a similar shape and format. Columbia University is available. There are other potential ways in which we could roll this out. Scaling this up can happen in a number of different ways, but the only way it happens is with our country offices recognizing or seizing the moment and saying, yes, we want to do something. This is not something we're pushing on any of you. It could be maybe not the right moment, but I think really thinking about, you know, we're hopeful that after you'll hear from these colleagues, and maybe we can open up quickly if we have the time for some questions and answers and discussions, that you'll go away and think about, you know, is something like this meeting your needs at the moment? And you might not be clear on what those needs are yet. And that's why I think hearing from both Maria and Azamat in terms of how they went through this process and what it meant to them and what it means now to them, what they're doing with it after all this time may be helpful for you to kind of grab a bit the reality of the experience from a country office perspective, which is always the best perspective to have. So with that, I will pass over first to Maria, and then Maria, when you're finished, Azamat, right over to you after that, and then we can perhaps open up if we have a few more minutes for any burning questions or comments on the way forward. Thanks.
Hi, thank you, Aaron. Hi, Tim. Very nice seeing you. Hi, Sholpan. Very nice seeing you again. And thank you for being with us.
Thank you.
I have prepared, with the support of Eleni Chronopoulou, you might remember her, she participated during the trainings, a short presentation, which I'm going to try to share, but our Wi-Fi is a bit sketchy today. Nope. I mean,
we can see it. Can
you see?
Please go ahead. Yeah.
Excellent. So yes, the training of trainings of trainers. We run it here in Greece in order to build the competencies of social services workforce. So, whoops, I've done something, I think. Right. So our objective was to enhance the skills of a senior social workers that work on child protection. Commonly with Columbia, we decided to be a 7 days online training, and it was a combination of the first, let's say, training that team presented already, and the more advanced sessions. We ran the training from November to December 2021. And after that, on January 22, we had the consultation sessions with participants, Columbia, the university. It's important to say that we decided to do it by developing a partnership scheme. So we had obviously Columbia, we had us, UNICEF country office, and then we had the National Association of Social Workers and the Mediterranean University, which has a school for social work. So we've done that. We formalized our cooperation with a letter of agreement, and we had the focal points. You already saw the name of Lina, who is one of the professors in the university, in order to have a more smooth process of collaboration. So for the selection process, we've done outreach through the National Association of Social Workers, and we had invitations sent out to 7,000 members of the association. But of course, there were some criteria that were set there. So we had, in the application, they had to fill in 53 questions. So what kind of experience they have, what motivation they had in participating, skills, and previous experience as trainers in training of trainers. We had valued the response from 145 people that were registered, colleagues that were registered. And in the end, we had the final selection of 25 participants that were chosen by the committee that was set up. So we had, in that pool of people that were trained, there were 22 senior social workers across Greece, most of them working in the public sector. And I'm saying that because they are the ones that have the accountability to conduct child protection investigations and assessment of need, etc. So we had people that worked in municipal social services. We had people working on juvenile justice, and also people that work in public residential facilities. We asked them to have 7 years. As I said, one of the criteria was to have 7 years of experience in the field of child protection, and of course to speak English. The majority were women. That doesn't come as a surprise, I suppose. The majority in our field are women. So in terms of highlights and feedback that we got, I was telling you the other day that even a few weeks ago, I met one social worker from Crete, and she said that this was a fantastic training, excellent experience. When are you going to continue with it? So the Agora comes on time. So they had a high involvement, the participants, and interest, and we said that we're going to translate the material and adapt it further to the Greek context, which is something that we need to do, we have ahead of us. They stressed that the importance of role-playing in case studies, and they wanted more of those. Exchange of views, that it would have been good if they had, that is person trainings, but anyways, to share experience and challenges. Supervision, it was mentioned by Tim, I think, again, is a gap here in Greece. We don't have statutory supervision as such. If they want to have supervision, to do that from on their own time and from their own pocket. And of course, we have the certificates. Now, we have ongoing collaboration with partners, that is the University of Mediterranean, I already mentioned, and the National Association, although we don't have dedicated resources at the moment. And we're going to enter collaboration with the whole university, that we're going to develop some sort of material and curriculum, if you like, based on the rights and the convention and how this can enhance social work practice. So we're definitely going to use the material in the training. And parts such as active listening and working with children, ethical dilemmas, etc., to build on those and enhance our own work. That's about it. So stop sharing. I don't know if there are any questions.
Thanks so much, Maria. I think we'll just move straight to Kazakhstan. I mean, it's great that you were able to embed this within the social work institutions. I mean, this is, to me, the important piece. And although the materials themselves are, module 1 and module 2 are not comprehensive and all-encompassing, they're very inspiring to build further on. They create a good base of material that can inspire for further, some of the challenges that were expressed or some of the, feedback of we wish we had more interactive time, that can be built in, right? That can be built in, and that national ownership and co-creation that these modules can inspire, I think, are the real takeaway. These modules are not meant to be sort of taken and transplanted as such. They're meant to inspire based on the most modern approaches and then contextualized and built upon. And it sounds to me like in Greece, that's the direction it's headed. And so really inspiring. But maybe we should turn to Kazakhstan and then see if we have a little time left over for any other questions from participants.
Thank you. Hello, everyone. And I'm glad to see everyone, especially pleased to present the experience of Kazakhstan, because I started my participation in the first phase of this program as an expert from the field, and in the process joined the UNICEF team and continued the implementation of the program on the UNICEF side. Kazakhstan was in the first cohort of testing the training curriculum. It was during COVID-19 pandemic in 2020. Our collaboration with Columbia University was an important milestone in strengthening knowledge and competencies of social service workforce in Kazakhstan, with focus on interpersonal skills and community engagement and elements of case management. We believe it has significantly impacted the professional development of national social workers. They established community of practice, which includes over 40 participants from academia and NGOs, has collectively achieved remarkable results. Based on this partnership, training programs, curriculum were developed or updated by several national universities, and these training programs have been disseminated across other universities as well. And a little bit about numbers. As a follow-up of the program, we have developed 2 educational methodological package for universities, 4 training models, 16 video lessons, 1 training course for mobile app for social workers, and we have trained more than 2,600 social welfare and child protection specialists and 28 national master trainers in basic social work competencies. UNICEF supported the established community of practice, and we believe that such platform should exist and be supported by the government, national academia, practitioners. The main lessons we learned from Kazakhstan is that having models and trained specialists provides only temporary measures. Universities tend to change their programs based on the government's request and allocation of funds, and independently decide how to use the developed materials programs. In the social sector in Kazakhstan, a major challenge for trained specialists is the lack of national legal regulation of case management. This gap prevents specialists from fully applying their knowledge and skills. However, our collaboration with Columbia University provided us with a pool of experts from academia and NGOs. This partnership helped us strengthen our advocacy strategy to push for the establishment of case management at national legislative level, enhance social work, and establish service for family in difficult situation. And finally, you can congratulate us. In April this year, Kazakhstan's president signed a law regulating comprehensive assistance to families in difficult life situation through case management. This law aims to increase the number of family support centers from 68 to 200, covering every city, district, and rural area. UNICEF has provided and continues to provide technical assistance in developing regulatory documents for case management, for activity of family support centers. Significant attention is being given to the digitalization of case management. UNICEF has received a request from the government to train social workers and to assist in the digitalization of case management. And this training curriculum in real time for us, and UNICEF will train social welfare and child protection specialists and help Ministry of Social Protection in developing an online course on case management with focus on child protection. So, in conclusion, despite these significant achievements, there remains a critical need to strengthen the capacity of large number of social welfare and child protection specialists in inter-sector case management and enhancement of supervisory work. These efforts are crucial to ensure the long-term sustainability and effectiveness of social services, providing comprehensive support to families across all countries, across Kazakhstan. So, thank you.
Thank you so much, Azamat, for sharing that extensive reach of your efforts. Really commendable, both to you and the colleagues in Greece for the work. And I know there are other country offices that were engaged that also had experiences with this that we just didn't have the chance to share today. I think, you know, a lot of UNICEF colleagues around the table, you know how these webinars go, right? And how these disseminations go. It's really with all of you now to help us understand how we can help you, whether we can help you or whether this helps you. We're keen to support you, but we are not, you know, pushing you to do this. We are presenting this as a global shared good, as a shared good for the region. It's been impactful. I don't think as a standalone, it will be very easy to attract resourcing for, but I think packaged with reform efforts that you're engaged with as a key component, potentially you could resource some of this work. And then there are ways that you can do it on your own. You have the assets, you have people in the regional office, you have Columbia University who can help if needed, or you could do it on your own with local stakeholders, or you could look to pool resources with other country offices around you that may want to do this. I think there are many different ways in which this can move forward, but we are very much now offering you the opportunity to think that through, to think if the timing is right, how you might want to do it. And maybe we can circle back to you after the summer, those of you who didn't pilot in the 8 countries, with a gentle reminder to just let us know if this is something you envisage for the end of 2024, 2025, and whether we can be helpful or not. But, you know, let me just stop there. We have 5 more minutes. And I think, you know, if anyone wants to come in with an observation, a suggestion, anything else, I think we should open the floor for the remaining period. So if I know this group well, I know that it only takes one to get started. So we'll just see who will be the first. Vincent, it would be great to hear from you from HQ. Would love to hear from you, please.
Hi, everyone. Huge congrats to everybody who participated. I've been following this for the past few years. It's just a great, amazing journey. I'm going to be quick. It relates to what you said, Aaron, about the ability that we have to pitch and push for adoption and for scale. I actually think the narrative in which we present these things is somehow important. And I just want to, remind the UNICEF colleagues that in the recent global management team there was a strong focus of the discussion on system strengthening. That was already the case in the GMT last year, by the way. And this year, the analysis that the senior leadership made was that UNICEF is quite unlikely to meet its strategic plan targets on system strengthening and on institutional systems. And it is likely to meet its target on reach. And so the message that all the representatives are going to get through regional directors and all is to accelerate on system strengthening. This is, to me, an amazing example of how we can strengthen systems. So just to say that, if you have engagement, advocacy activities, if you're trying to convince people at least internally in UNICEF, you should consider this angle and attach it to the broader picture of what UNICEF mission is. It is where, surprisingly, even though we spend most of our money, our targets are not moving fast enough. So just a piece of advice if you are building advocacy points. And again, huge congratulations to Mario, the colleagues, Aaron, all those who contributed.
Thanks so much, Vincent, and thanks so much for helping us with all this process and for promoting it more broadly within the organization. It's really important. Anyone else want to come in with a few? Okay, Helena, please.
Hello, colleagues. I hope you can hear me. Sorry, I cannot turn my camera on. My internet is not very stable today. Huge congratulations to everybody that has been working in this package. I just wanted to share a reflection, like what we've been seeing in terms of use of any course related to SBC in Agora, is that the uptake increases exponentially when the training is mainstream in national academic institutions. So just sharing these in case we can really, whenever feasible, advocate for the inclusion, at least of some of these modules, into regular curriculum. I think this is a very good way to go. Thank you so much. And again, congratulations to the teams.
Thank you so much, Helena, for that. And I think we heard from the colleagues in their presentations the focus on that. And it's exactly that which I think echoes Vincent's point about system strengthening and strengthening those longer term platforms for more systemic change. An important point to underscore. Margarita and then Trajan.
Yes, thank you so much. Also, the GBV specialist for those of you that don't know me, and obviously very excited to be able to leverage this curriculum also for the support that we bring forward in that field. I think we've been hearing a lot of needs from countries that we support around this. And the attitude, beliefs, and behaviors piece in particular is so relevant in the field of gender-based violence, and something that we often somehow miss. And so just, again, big thank you, and very excited to be able to use and support the different countries with this work.
Thanks, Margarita. And Trajan, please.
Yes, thank you. All right. Thanks a lot. The question is whether there is anything available in Russian in the countries that have piloted. I think this would be extremely useful because I've seen a lot is there in English, but we all know that there are a few countries which still use Russian for capacity building and social workforce. At least in Moldova, they would rather know or speak better Russian than English. Also, I was very curious to learn about the mobile app. That's very interesting, Azamat. I will get back to you on that because I think that's a very great idea. Also, if I may ask our colleagues in Greece, I think Maria, if she's still here, whether there is any connection to the child rights centers that Greece has put in place this year, and how you see the interconnection with those centers. Thank you, Ova.
Thank you, Trajan. I think the only other language that it's available in at the moment is Russian. So you're quite fortunate from that perspective, as are Russian speaking countries and countries that can operate in the Russian language. So indeed, many countries will have to translate these materials into the local language. For Russian, I believe that is not the case because we have done this in Russian. Am I right in saying that, colleagues? I think I am. Am I? Yes, I see nodding heads. So, Trajan, you are in luck.
We translated all materials in Russian, but since it took some months to adapt, so what I wrote in the message in the chat that we still need to adapt to make it like what is at Agora.
Yeah, so they're available, but they're not yet up on Agora. But we can share them with you if you need them immediately. They'll be up on Agora soon. Yeah. Great, colleagues. Is there anything else? I don't see any other hands. I saw a hand, but it seemed to have went down. I didn't even realize who that was. We're at the hour. We're a little bit over the hour, but not too much. So we did hold to time, which is always something to be celebrated as well. I'm not sure if I'm the one to say goodbye, but it's not goodbye. It's talk to you soon. Maybe Mario, back to you.
Yeah, thank you, Aaron, and thank you, colleagues from Columbia University. I also want to thank collaborators that are also connected in this call. Rania from SQ, SBC SQ, Shiva, our regional advisor gender, are contributing, revise every module. And of course, as you can see in the introductory page of the package, you are going to see acknowledgements to the contribution from country offices, colleagues that were very hard in this process. And then, as Aaron said, this is a conversation, it's a continual conversation. We are interested to know how this package resonates in your context. The other thing has been said, and how that can be integrated into wider efforts for strengthening system or connecting to childcare reforms, for instance, to gain sustainability and scale. And of course, thinking about delivery models, as Aaron said at the beginning, so looking at economy of scale, looking at sub-regional collaboration with local partners. So we are looking forward what is next. And then again, thank you everyone for participating and providing comments. So have a great weekend.
Thank you all.
Thank
Bye,
you.
everybody.
Bye.
Thank you.
Bye-bye.
Thank you.
Bye.
Thank you.